All righty, we're back here for session number 19 or tip number 19 in our medical exercise training 101 ebook series. Now, this one is an interesting one. When we put this one together years ago, we kind of were reluctant about it, but I think it's become even more important now in 2022. What is the average number of MET sessions most MET clients require? Wow, that's a pretty powerful question, because I know as a personal trainer, you're going to see the client just until they stop. So at some point, medical exercise training should end. Medical exercise training is never designed to be an infinite scenario. It is designed to be finite. Now, once the client has reached their goals, you've achieved everything you wanted to with the client, now you can continue on providing personal training services. But we have to look at how long, how often, how much for the medical exercise training client, because at some point, everything should end. You ever heard of clients going to the doctor forever and ever and getting a pill? Well, same thing could happen with exercise, but you'll say, well, it's exercise. Well, do they need medical exercise? Usually is a higher charge, or do they need just personal training, which may be a slightly lower charge? Not worse or better, but slightly lower, because the medical exercise training requires a higher level of understanding and knowledge. And if you went through our MES program, you had to put up with me for some 44 hours. So what? So let's talk about the average number of MET sessions most MET clients require. This is number 19. The number of sessions an MET client requires varies based on the severity of the condition, whether or not the client has undergone surgery, their age, and their level of health. But let's explore some of the common conditions and the number of sessions they generally need. The first is osteoarthritis. In the early stages of medical exercise training, an osteoarthritic client will require 1 to 2 sessions per week. These initial sessions are designed to improve strength, flexibility, improve endurance, and reduce weight. As the client improves, the frequency is moved to 2 or 3 times per week. As the client's strength, flexibility, and endurance improve, he or she now can tolerate a greater frequency and intensity of exercise. Lumbar clients generally need 2 times per week for the first 4 to 6 weeks. The program initially focuses on improving spinal stability, strength, endurance, cardiovascular endurance, strength, lower extremity strength, as well as weight loss. After this initial period, a reassessment is performed, and if the client is progressing well, then the sessions may be increased up to 3 times per week. The program intensity is also increased. The lumbar client should be reassessed every 30 days and continue with spinal stabilization, upper and lower extremity strengthening, and weight management. Total joint replacement clients normally require programs consisting of 2 sessions per week for 4 to 12 weeks. These programs focus on improving lower extremity strength, core strength, balance training, and cardiovascular endurance, and for some clients, weight management programming due to weight gain associated with the total joint replacement. Hypertensive, diabetic, and obese clients require frequent training starting at 3 times per week. The exercise should include low-intensity cardiovascular training, strength training, daily blood pressure monitoring, and blood glucose self-assessment. A lifestyle management segment should be incorporated into the program for these clients. Clients with shoulder and knee conditions require 2 days per week for 8 to 12 weeks. If these clients have severe arthritic changes or have undergone surgery, longer programs may be required. The exercise program should incorporate strength training, flexibility training, weight management programming, and the correction of postural and muscular imbalances. Now, folks, I have to be honest, that's very general. And let me say this. We gave you some general guidelines here, but this will vary from client to client depending on where they are with their progression after physical therapy, chiropractic, and other services are done. They may exacerbate their conditions. They may have gone back to work, which is causing the exacerbation. So there's a wide range of possibilities here. We're just throwing out some ideas to you so you at least have a general idea. Now, I can tell you in physical therapy, we have some general ideas on certain conditions and certain ages and that go along with the condition as to how often the client can come, but maybe the client can't come as often as we like. Or maybe the client is available to come when we like, but at some point we're going to gradually reduce the sessions. So this becomes important. This varies from client to client, and it varies from condition to condition. We're just giving you some general guidelines. And again, this is one where I think joining the MedX Pro Network and sharing with other medical exercise professionals what their thoughts are on this might be something that'll be beneficial for you. So again, just general guidelines. Please join us for our next session. And in session number 20, we'll talk about your options with regard to where you're going to locate your medical exercise training practice. Thanks again.